So Botox is a neurotoxin that actually helps to block some of the chemical signals that your muscles produce that prevent the contraction of those muscles. Some cosmetic benefits of Botox is to decrease the amount of fine lines and wrinkles within the face, the neck, and different areas of the body. In a health situation, Botox can also be used outside of cosmetic purposes for muscle spasms, migraines, different bladder issues, so it's a multifunctional type of medication. Some disadvantages of Botox would include changing your facial structure over time. If you overdo it in certain areas, it can actually change the way that you animate and the way that you look. And then again, if you are getting this by an untrained medical professional, it can also pose as a risk factor to where it's being injected. And we mentioned earlier that it could be used for urinary issues, bladder spasms, things like this. However, a lot of patients suffer from migraines and excessive sweating. On the migraine end of it, you can sit there and do injections to the top of the forehead, around the ears and the temple area. You can also sit there and do the base of the cervical spine or the traps. That helps to relieve a lot of the tension within the cervical spine area, which would help to decrease the amount of tension or even prevent the migraine from happening. And then even with excessive sweating or hyperhidrosis, a lot of patients suffer in multiple areas, either underneath the arms, in the palms of the hand, or in the soles of the feet. Even on the forehead can also be in areas of hyperhidrosis. And if those are treated with Botox, it helps to minimize the amount of sweating. So patients are a little bit more comfortable. They can go throughout their day not only for cosmetic, but for also personal reasons too. So individuals who are able to administer Botox would be those who are well trained and certified in administering the toxin. Usually that includes a nurse with supervision or an NP, PA, MD, DO. And with these individuals, the biggest thing is you want to make sure that they're coming from a credible source, that they go through reputable training. You can also ask to see that their licenses are up to date, so that way that they are current with the amount of training that they do. Individuals who are good candidates for Botox would include those who are 18 and older, who are not pregnant, and who are not breastfeeding. For health purposes, you would be able to get a medical consult with your physician. So if you do have migraines, excessive sweating, muscle spasms, you can go and consult with them. If therapies have been tried and failed in the past, this could definitely be a beneficial option for you.